Welcome to today's education podcast. We're diving into a vital but often overlooked aspect of personal care, and that is mouth care.
That's right. Mouth care isn't just about comfort, it's essential for overall health. Poor oral hygiene can lead to hospital infections, pain, and even difficulty speaking or eating, especially in a hospital setting.
Yeah, absolutely, Marshall. And it starts with the basics. Keeping the lips moisturized using a water-based gel or balm to prevent cracking. Hydration is key too. Encourage regular sips of water unless obviously contraindicated and steer clear of sugary drinks.
And let's not forget, mouth care is everyone's responsibility. Nurses, carers, allied health professionals, we all play a role in maintaining good oral health.
So, how do we assess who needs what? So that's where the traffic light system comes in. Every new patient should have an oral hygiene assessment.
For our red patients, they are high risk. We need to monitor them every 4 hours and give them full assistance. Think about end of life care, continuous oxygen, null by mouth, unconscious stroke patients, or those with advanced cognitive decline.
And the next one are amber patients. These are the medium risk patients. They might need some little help, like those with Parkinson's or mild cognitive issues. The goal here is to support them while maintaining independence and also preventing deconditioning.
And then we have our green patients. They are low risk and mostly self-caring, but they still need to be orientated to the ward and encouraged to keep up their own oral health.
Right. Now, Marshall, let's talk about tools and techniques. Use a small, soft toothbrush for gentle cleaning and not the larger headed ones. Forceps and gauze can help remove debris. And if needed, we can use superficial suction with a yanker. But avoid deep suction unless obviously you're trained. And always be mindful of the gag reflex.
Oral care kits are for moisturizing lips and mouths only. Do not use the pink sponges to clean inside the mouth. And Oral Leave is a great dry mouth relief. It does require a prescription, but you don't need to wait for it to be formally issued before applying. Oral Leave can also be used inside the mouth as well as on the lips.
Right, Marshall. Now let's talk about the brushing technique. Yeah, we use a pea-sized amount of fluoride toothpaste on a small-headed toothbrush, and then we brush downward on the top teeth and upward on the bottom teeth using a gentle circular motion. We pay close attention to the crevices where food and debris hides.
And remember, inspection is just as important. Use a medical torch to check the roof of the mouth, the cheeks, and the tongue, especially under the tongue, as food and medication often get stuck there.
And for patients with dentures, ask the next of kin to bring in Fexodent and Steradent. Make sure that the dentures fit properly and are cleaned regularly. Soak them in Steradent for about 15 to 20 minutes. Any longer than that can degrade the material.
Store dentures in a labeled pot and to keep them hygienic and avoid mix-ups. Also, don't forget to document all oral care on Alex Health to ensure continuous care and accountability.
In this video, we'll show you how to clean and care for a denture. There are different types of dentures: metal, plastic, some that replace all teeth, and others that replace one or a few teeth. Dentures should be regularly removed and rinsed to remove food debris and cleaned thoroughly at least once during the day to help prevent fungal infections. The denture should be safely removed either by the wearer of the denture or a carer and placed in a bowl or denture container. For a patient who needs help removing a denture, wash hands and put on gloves. For an upper denture, slip finger by side of denture to break the seal and lift the denture out of the mouth. Do the same for a lower denture. If there are clasps on a denture, push them up for a lower denture and down for an upper denture. Partial dentures can sometimes be tricky to remove. Fill a bowl or sink with water. The denture should be brushed over a bowl to prevent breakage with a denture brush or toothbrush for natural teeth. The denture should be brushed using liquid soap or denture cleaning paste. Toothpaste can cause damage to the surface of a denture over time. All the surfaces need to be brushed. Next, thoroughly rinse with water to remove the debris and soap. If a fixative is required, the denture should be dried using a paper towel and a small amount of fixative applied to the contact area of the denture, and then the denture fitted back into the mouth. When not being worn, the denture should be stored in a named denture pot. It's important to clean the mouth and tongue when the denture has been removed, even if they have no teeth. Ideally, denture should not be worn overnight to let the lining of the mouth recover from wearing dentures during the day.
And that wraps up today's episode. Thank you so much. So remember that mouth care might seem small, but it actually has a big impact. Thank you very much for tuning in.
And remember, good oral care starts with good teamwork. My name is Marshall.
And my name is Crystal. Thank you so much for watching. I hope you find this useful, and please visit our podcast channel in AlexNet and also in YouTube. And also please don't forget to tell your colleagues about our podcast. Thank you so much. Bye.
Bye.